Okay, very good morning, students. Let me check. Yeah, just checking, students. Yeah, just checking, students. Yeah, it's working. So, yeah. So, a very good morning once again. So, today also we'll take image-based question, students, as yesterday also we take. So, we took few. So, we'll be taking the remaining part of all the image-based questions. It is important for all of us, to understand and to identify the image in the best possible way and to answer correctly, right? So, let's start, and let's start with the first one. Right. So the first question says, if a test has cutoff value at point A, now suppose this is the cutoff line. If this cutoff line is brought at point A, what will happen after that? Is you will have high positive predictive value, low sensitivity, low positive predictive value, high specificity, students. Try this. So this is the cutoff line. If it comes from this line to suppose on at A, so very much near to this. So what will happen to the what will happen? You will have high positive predictive value, you will have low sensitivity, you will have low positive predictive value, you will have high specificity. Try, students. Anyone? A. Okay, Yash goes with A. Mahesh. Yeah, Meher. Meher, what is the answer? Anyone try? Somebody saying A. Okay, let's try to understand, student. First of all, how do you understand this question? So, you see how we should answer this. You have patient without cancer. This side means these people are healthy, right? These people are diseased, right? Okay, yeah. So somebody is, yeah. Let's try to see. Let's try to put a reason. So if this is the cutoff line, so this is my true negative, so this part is my false negative, and this part is my false positive, and true positive is already there. Now you are bringing this line to this side. So you're bringing the line this side. When you're bringing the line this side, your false negative is coming down, your false positive is increasing, students. Now, if I put a table, 2 by 2 table, so what happens? It looks like true positive, false positive, and true negative. So this is the positive and this is negative. This is the way we do our 2 by 2 table. Rough sketch I have drawn. So what has happened in this? Your false positive is increasing. When your false positive is increasing, so if I have to calculate positive predictive value, so positive predictive value is equal to true positive divided by true positive plus false positive. So when this is increasing, your denominator is increasing, definitely positive predictive value will not increase. So this cannot be the answer. The answer based on this looks like this. Because when your false positive is increasing, your positive predictive value will go down. Simple. So we should always go with answer low positive predictive value. Okay. Now let me explain in writing. So you have a lower cutoff value, false positive is increasing, false negative is decreasing. When your false positive increase, your positive predictive value will be low as false positive is increasing. Simple. Sensitivity will increase and specificity will decrease. Why sensitivity will increase? Because Now, declared positive have more chances of having disease, and specificity will decrease because more non-disease are classified as disease. So, the best way of the simple way of understanding is, if you know this, what is this part? This is my false negative. This is my false positive, and this line is coming this side. So your false positive is increasing. When your false positive is increasing, definitely your positive predictive value will be low. Simple, right? Okay, let's come to the second question, student. Identify this National Health Program symbol as given in the photograph. Is it NRHM? Is it NPCB? It is NPCDCS? Is it IDSP? Try this. So this image looks like what? What is this? Is it NRHM? Is it NPCB? Is it NPCDCS? Is it IDSP? Yes, Chandan goes with D. Anyone else? Try, students, everyone should try. Okay, majority D followed by someone C. Yeah, so if you see this symbol, basically this is, IDSP. Now, what is IDSP? IDSP, it is an integrated disease surveillance project program which is looking after the surveillance activity in the country. It started in 2004 and then it was till 2010, and again it is now it is continuing across the country. What does this IDSP do? IDSP is, and nowadays in COVID time it has got a very prominent role because it tries to do the surveillance, ongoing activity, tries to identify the epidemic which is possible, there is a possibility that it can happen, and it detect and respond accordingly by having a rapid response team. Each state has got a IDSP unit. Each state level also they have got, and district also they have got. At the district level, we have a DSO, district surveillance officer, who looks after this IDSP, and so it's an integrated disease surveillance program, and it is an ongoing thing. The importance was much felt in during COVID when this IDSP was trying to do a community surveillance to identify the COVID cases. So that was a symbol of IDSP. Okay. Now this is the new symbol, students, not asked, but there is a possibility that this can be asked. Try to identify the program in this image. What this image reflect? Which program does it reflect? Is it NTEP? Is it NPCB? It is RMNCHO, or it is JSY? Try this. This is the new one. Sawan Thakur goes with C. Okay. Anyone else? Meena goes with B. Anyone else? Students, try to see this once again. If you see this picture, you can see here lungs. Is it visible? You can see here lungs. So this is the new image which has been associated with National Tuberculosis Elimination Program. Right? It is not NPCB, it is not RMNCH, it is not JSY. It is National Tuberculosis Elimination Program. I'll just show you the bigger picture. You see this. So because RNTCP got changed, now it is NTEP. Now NTEP, you cannot say a revised National Tuberculosis Control Program when you are talking about elimination by 2025. So they have come with a new logo, National Tuberculosis Elimination Program. You see, you have the picture of lungs here, and then it is written here TB Mukt Bharat, and at the bottom they have written TB Harega, Desh Jeetega. So this is the new symbol logo which reflects National Tuberculosis Elimination Program. Okay, please remember, because the new one, there is a possibility they can ask. Okay, now the easy one. Order for the margin of error in the graph given is. So you have three graphs, 1, 2 and 3. The sample size is also given, the picture is also there. So you have to just order the margin of error. Which one has got more error, followed by that, followed by that. Is it 3, 2, 1? It is 3, 1, 2. Is it 1, 2, 3? Or 1 is equal to 2 is equal to 3? Mahesh goes with A. Anyone else? Sound goes with A. Very good. Yes. So now come to this question. Now if you see this, the sample size is 600. The third graph, you see this one. Second graph is has got sample size 800 and 1000. Simple understanding, students. As you increase the sample size, the error decreases. Why? Because suppose if you take an entire population, suppose the total population is of 1000. My universe, my total population is of 1000. And what I do, I take first a sample of 50, right? And I take an average, just an example I am giving, and I am taking an average. And I am saying based on this 50, I am representing 1000 people. Somebody else come, he said, no, why should I trust your value? Let me take 100 people now. Then he comes with an average. Somebody else comes, he takes 200 people and he gives the average. So as the sample is increasing from 50 to 100 to 200, actually what we are trying to do, we are trying to reach to the exact population. Means you are increasing the sample. When you are increasing the sample, the error will come down, because the sample will be is in a position or trying to be an exact representation of the population. So the error will be less. As simple as anything. So if you see, you have 600, 800 and 1000. So error will be more in 600, followed by 800, followed by 1000. So 3 greater than 2 greater than 1. So we go with the answer A. Simple. Okay. Okay. Let's move to the next one. So you have a box and whisker plot. This is a box and whisker plot, students. You have to identify what is not true about the image given below. What is not true about the image given below? Is it negatively skewed? Is it positive skewed? Is it mean less than median or mean less than mode? Try this. So what is not true? Meena goes with B. Chandan goes with Mahesh goes with C. Okay. Anyone else? Okay. Let's try to understand this. Okay. First of all, what is not true in this? What is not true is positive skewness. This is not true. Wait, I'll explain it. So the answer to this question is positive skew, which is not correct in this. Okay. Don't worry, students. Take one more questions on the similar pattern, and then I'll try to explain both. So you have a box and whisker plot 1, 2, 3 given. The following box plot shows the distribution of 3 sets of data around the mean. What is the correct sequence if inference from this box plot has to be drawn? So what is 1? 1 is normal distribution, 2 is positive skew, 3 is negative skewed, or 1 is normal distribution, negative skew, positive skew, or negative skewed, positive skew, normal distribution, or positive skew, normal distribution, negative skew. Try in this. So both the questions are very much similar. So once you take this question, then I'll try to explain both the question with a simple understanding, so it becomes easy. So somebody is saying C, somebody is saying A. Anyone else? Try. Okay, C, A and all. Okay, first of all, the answer to this question is B, right? Now, how 1 is normal distribution, how 2 is negative skew, how 3 is positive skew. So, two questions based on similar lines, we have to understand this. Now, first of all, what should be done? So, let's try to understand. So, this is your box and whisker plot, students. This is the smallest value, though these are the whiskers. The line is the whisker and the box is the box. So if I start from this side, so this is my smallest value and this is my greatest value, right? And this box is basically I represent with quartile. Please try to understand this quartile. And you know what is quartile, Q1, Q2, Q3. What is quartile? If I take a line, if I divide by 3 intercepts, I get 4 equal parts. So this is my first quartile, this is my second quartile, this is my third quartile. So if I take 3 quartile, I get 4 equal parts. Now this box is my, I will represent this box by quartile. So this line, I treat it as first quartile. The middle line I treat as median, or it happens to be Q2, quartiles Q2, and this is my third quartile. So this is the nomenclature, how you can put what is what. So this is smallest value, this is the greatest value. So difference between smallest and greatest becomes a range. Then this is your first quartile, this is your second quartile, this is your third quartile. Now I know what is what. Now see what is happening, student. Just try to see the picture and understand. What I will do, we have understood, so this is my Q1, this is my Q2, and this is my Q3. Now students, if I ask, what is the difference if I subtract Q3 minus Q2 and Q2 minus Q1? So can you say this area, this part is equal to this part? It looks like, so because Q2 is in middle. So Q3 minus Q2 is equal to Q2 minus Q1. So Q3 minus Q2 is equal to Q2 minus Q1. If this is the structure, this is normal distribution. Now come to this second one. Again I'll put Q1, Q2, Q3. Now here you can see and you can say that Q3 minus Q2, this part of the graph, is greater than definitely this part. So Q3 minus Q2 is greater than Q2 minus Q1. So this is my positive skew. Again come to this Q1, Q2, Q3. It looks like Q3 minus Q2 is less than Q2 minus Q1. This part of the box is greater than this part of the box. So Q3 minus Q2 is less than Q2 minus Q1. So this is called negative skew. If you have understood this, come back to the question once again. This was my last question. Again, based on simple things, students, don't do anything. Just put here Q1, Q2, Q3. It looks like the first one, Q3 minus Q2, is equal to Q2 minus Q1. So 1 is normal distributed. Let's come to the second one. Q1, Q2 and Q3. It looks like Q3 minus Q2 is less than Q2 minus Q1. So this is my negative skewness. Again put here Q1, Q2, Q3. Again you can see here Q3 minus Q2 is greater than Q2 minus Q1. So this is my positive skewness. So I'll go with answer B. Come to the previous question. This. Again put here Q1, Q2, Q3. So Q3 minus Q2 is less than Q2 minus Q1. So this is negative skew. This cannot be positive skew. So they have asked you not true. So the answer is positive skew. Is it clear, students, how do we solve when skewness is asked on box and whisker plot? Nothing has to be done. It's very simple. Just you have to put Q1, Q2 and Q3 and try to see which, if the data is normally distributed, Q3 minus Q2 will be equal to Q2 minus Q1. If it is not normally distributed, it can be positive, it can be negative. Okay, so the overall understanding of this question, these two questions, depends upon this part. If you know this, it becomes easy. Okay. Okay, let's move to the next question. You have a symbol here, students. This symbol relates to what? Is it health promotion? Is it primary health care? Is it SDG? Is it MDG? Try this. What does this symbol represent? Health promotion, primary health care, SDG or MDG? Mahesh goes with A. Anyone else? What this logo or what this symbol is? Okay, Weber goes with B. Okay. Now, this symbol basically relates to health promotion. And what is this? I'll just explain. And this has got two important conference related to that. So this is basically, I'll just show the bigger picture. Yeah. So this is first of all Ottawa Charter. Ottawa Charter for Health Promotion. Ottawa is a capital of Canada, right? So what happened in 1986? So there was a conference on health promotion in Ottawa, right? 1986. So this was after 1978. 1978 we had Alma Ata conference. If you remember Alma Ata conference on primary health care. So after this in 1986 we had a conference on Ottawa on a health promotion at Ottawa. So it is called Ottawa Charter. So this was basically built upon primary health care at Alma Ata. Now what is this Ottawa Charter? So it has this logo, you know. So you have a outside circle. And just you have an outside circle, students. And this outside circle is basically build public health policies. Then inside this outside circle, you have a small circle inside, which basically forms the strategy of enable, mediate, and advocate. And then you have three wings. One wings crosses outside. Crosses outside means it says that let's strengthen the community action, develop personal skills. Second one, create supportive environment and reorient health services. So this is the logo of Ottawa Charter, which was on health promotion. But there is a problem. In 1997, we had Jakarta Declaration, which was also on health promotion. And this was, if you see Jakarta is the capital of Indonesia. So what happened in 1997? All the developing countries also participated. In Canada, majority of the participation was from the developed countries. In Jakarta, developing countries also participated with involvement of private sector also. And they were basically focusing on the challenges which the planet is facing in 21st century. And this led out to the priorities for health promotion. Now, what were the priorities for health promotion in Jakarta Declaration? Social responsibility, students, one way. Investment should increase in health. Partnership, consolidate and expand partnership. Community capacity should increase by empowering individual and secure infrastructure for health promotion. So this was on Jakarta. Now, if you compare Jakarta and Ottawa Charter, both were on health promotion, but what are the fundamental difference? Fundamental difference where it happened in 1986, 1997, it was in Ottawa, it was in Jakarta. Here, developed countries participated. Here, developing countries and private sector people participated. This emphasized that promoting health is more than just providing health services. This addresses the challenges which the countries are facing in 21st centuries. So Ottawa Charter was basically on strategies and Jakarta Declaration was basically on priorities. Now what should be the priority? Now if you know this, now you compare. Now public health policy, supportive environment, community action, personal skills, reorient health service, all these are strategies. And you see they have prioritized social responsibility, investment, partnership expansion, community capacity increase, and infrastructure. So this is the two declaration both on health promotion, but there is a fundamental difference between Ottawa Charter and Jakarta Declaration. Okay. Okay, let's try to identify this. Who is the chairman of agency shown in the photograph? Try this. Who is the chairman of agency shown in the photograph? Is the Minister of Labour, Defence Minister, Prime Minister, Minister of Health and Family Welfare? Yes, this should be the easy one. So it is National Disaster Management Authority, NDMA. So National Disaster Management Authority, so you have to handle the disaster. Now disaster, student, is not restricted to health, neither restricted to defense, neither restricted to labor. Disaster impact is overall. When the impact is overall, one ministry, one department cannot handle it. It cannot be the whole and sole responsibility of the labor department or the defense ministry or the health department. So who will be the overall in charge is the prime minister, because he is the head of all the departments. So he will be taking care of NDA. He is the chairman of NDMA. Okay. Now come to this. Identify the National Health Program symbol as given in the photograph. Is it NRHM? Is it NVBDCP, RCH, NPCDCS? Try this, students. Who is the basically, what is this symbol? Okay, very good, students. So it is, I think, students, NRHM fine, National Rural Health Mission, RCH of the reproductive child health is fine, but this NVBDCP, I will advocate, or NPCDCS, I will advocate, don't go into the short form because it creates problem. It's difficult to I will go vector-borne disease control program and national. So it is easier to remember National Vector-Borne Disease Control Program rather than remembering or getting into NVBDCP. That is not easy. So it's better to remember National Vector-Borne Disease Control Program because it is talking about vectors, as you can see the picture also. So it is National Vector-Borne Disease Control Program. Okay, let's take the next one. Identify this image. Identify the symbol as given in the photograph. What is this? National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, National Mental Health Program, National Tobacco Control Program, National Oral Health Program. Yes, try this. Yes. Very good. So it is written health in your hand. Aapki sehat, aapke haath. So health in your hands. So whenever this lifestyle diseases, lifestyle modification, it comes under NPCDCS. Now this also creates a problem. NPCDCS, it's better to remember National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Stroke. So cancer, diabetes, cardiovascular disease and stroke, and there is a National Program for Prevention and Control. So this is NPCDCS. Okay, let's move. Patient presented with feature of diarrhea, dementia, dermatitis, and clinical features as suggested in image. What is the diagnosis? If you see this, what is this? So what is the diagnosis? What deficiency it is happening due? Is it vitamin B1, B12, niacin, pyridoxine? Try it. Yeah. Yeah. Yes. So necklace castle, absolutely. And which also it is diarrhea, dementia, dermatitis. So basically it is due to deficiency of niacin. And you know the disease pellagra is basically diarrhea, dementia, dermatitis, and it can also lead to death. Pellagra is common in maize and jawar eating population. The limiting amino acid is tryptophan, and 60 milligram of tryptophan is converted into 1 milligram of niacin in the body. Excess of leucine also interferes in conversion of tryptophan to niacin. So there is a deficiency. So this happens. Yes, very good. Now identify this image, students. What is this? Identify the organization in this. Is it WHO? Is it UNICEF? It is UNDP. It is UNAIDS. Yes. No, Webab, it is not UNICEF. It is WHO. It is World Health Organization. Yes, it is WHO. It is not UNICEF. It is WHO. Okay. Now, Webab, you can see this. What is this now? Is it WHO? Is it UNICEF? It is UNDP. It is UNAIDS. So if you see this, you have a mother, you have a child. So when you have a child, so that is basically UNICEF. So this picture is UNICEF. Yes. Okay, UNICEF, just one thing. United Nations International Children Emergency Fund. This was the initial full form, but now we say United Nations Children Fund, though the acronym means short form is UNICEF only. But if somebody asks what is the full form, it is United Nations Children Fund. Now, headquarter location of International Health Agency depicted in the photograph. Now, this image, which is here, where is this headquarter? It is in New Delhi, Geneva, New York, Rome. Try this. Very good, Chandan. Anyone else? Yes. So it is in Rome. Absolutely right. Okay. Identify the organization depicted by symbol as given in the photograph. Which organization is this? It is DFID, it is World Bank, UNDP, UNAIDS. Try this. Which organization is this? Yes, very good, Chandan, Mahesh, and others. It is definitely World Bank. Very good. Now, identify the organization in this. Which organization is this? Is it UNAIDS? It is World Bank. It is UNDP. It is UNFPA. Try this. Okay. Very good, Anuj, Sawan. No. It is UNFPA, United Nations Fund for Population Activities. It is UNFPA. Okay. Now, a list of all the organization: WHO, World Health Organization, headquartered Geneva, Switzerland, UNICEF, wherever United Nations comes, students. United Nations Children Fund, New York, USA. United Nations Development Program, New York, UNICEF, USA. United Nations Population Fund for Funds for Population Activities, New York, USA. So this is done. FAO, Food and Agricultural Organization, Rome, Italy. ILO, Geneva. International Red Cross, Geneva. World Bank, Washington, DC. So these are the headquarters. So if for WHO, we know it's Geneva, Switzerland. United Nations, all the organization, it will be in New York, United States of America. FAO, Food and Agriculture Organization, it is in Rome, Italy. And ILO, International Red Cross, is also in Geneva. So WHO, ILO, International Red Cross in Geneva, World Bank in Washington, DC, and rest United Nations, everything in New York, United Nations organization, all in New York, United States of America. Food and Agricultural Organization is in Rome and Italy, right? So this slide is help us to remember all the headquarters and their full form also. So students, I'll stop it here, and I hope the session was useful. Thank you very much for joining, students. Take care. Bye-bye.